So up here we have another popular drug, okay, and the name is what? Labetalol. Okay, so you get to look at what the pharmacology of this labetalol. I get to see that what is a beta blocker. All right, so it's used to treat some conditions of the heart, which you get to look at. We look at the pharmacokinetics. They'll get to look at the indications and side effects of this drug. Okay. So for the overview, we see that this labetalol is a medication used primarily to treat what? High blood pressure, that's hypertension. And you also use it to manage what? Any hypertensive emergencies, okay? So let's quickly look at the overview of what? The pharmacology of this drug, okay? So for mechanism of action, we say that labetalol works by what? Blocking alpha 1 and beta 1 and also beta 2 adrenergic receptors, okay? So this dual action helps to what? Relax blood pressure. Dual in the sense that it blocks both the alpha and the beta. Okay, so it helps to relax blood vessels and slow the heart rate. Then in turn, it lowers the blood pressure. Okay, in turn, it lowers the blood pressure. Then for the pharmacokinetics, for absorption, so when the drug is taken orally, labetalol is absorbed with a bioavailability of about what? 25%. Intravenous administration results in what? Faster absorption, right? Then how about the distribution? It has a volume of distribution of about 2.5 to 15.7 liters per kilogram. Okay. Metabolism, labetalol is metabolized in the liver. Primarily, it is done via what? Glucuronidation. Okay. Excretion. It is excreted mainly through urine. About 55 to 60% of it as what? Glucuronide conjugates. And it is excreted to a lesser extent in feces. Okay. Onset of action, oral administration takes about 20 minutes to 2 hours to start working, while intravenous administration works within 5 minutes. Okay. Duration of action. The effect of these drugs lasts for about 8 to 12 hours for oral doses and about 16 to 18 hours for intravenous doses. Okay. Half-life. Elimination half-life is approximately 6 to 8 hours. Okay, that's for oral doses, and about 5.5 hours for intravenous doses. Okay, indications now. In what disease conditions will you use this drug? Okay, so it's indicated in the management of what? Hypertension, both the chronic one, that's the one that's been there for a very long time, and the acute one, that's the one that have been there for just a short while. Okay, also hypertensive emergencies, also hypertension during pregnancy, including preeclampsia and eclampsia. Then angina pectoris, management of angina pectoris. Okay. Side effects of this drug can include things like what? Dizziness, fatigue, nausea, low blood pressure. Serious side effects of this drug, can include what? Heart failure, bronchospasm, and liver problems. Okay. So on that basis, that's the pharmacology of what? Labetalol.